Today we are going to look at the relationship between the anion gap and pH. These two concepts are often mixed up and many learners struggle to understand them clearly. So today I'll explain them using a simple and memorable framework. First, the main point. The anion gap and pH are basically unrelated concepts. Think of them as separate topics. This is a very important starting point. Imagine body fluid inside a bottle. Inside this bottle, there are positive ions and negative ions, always kept in balance. You will never have a situation where only positive ions accumulate or only negative ions accumulate. If such an imbalance occurs, the body will immediately adjust it. The ions we can actually measure are sodium, chloride, bicarbonate. But in reality, there are other important anions that we cannot measure. Non-volatile acids such as phosphate, sulfate, lactate. These are metabolic products, and most of them carry a negative charge. Here is a key idea. The difference between the total amount of unmeasured anions and the three ions we can measure is represented as an anion gap. But another way, anion gap is essentially an index of unmeasured anions. Despite the familiar formula, sodium minus chloride plus bicarbonate allows us to estimate the amount of unmeasured anions. Why is this important? Because these unmeasured anions include clinically important metabolic acids such as lactate and ketone body. These acids are extremely helpful for diagnosing disease, and although we cannot measure them directly, we still want to know their quantity, even if it requires calculating the anion gap manually. This is one of the most important concepts when we run anion gap, so make sure to remember it. Now let's move on how anion gap relates to pH, a topic they are often discussed with. Factors that shift the body toward acidity mainly include bicarbonate and the acids that makes up the anion gap. Natrium and chloride do not directly affect pH. Metabolic acidosis occurs through one of two mechanisms. When unmeasured anion increases, to maintain electron neutrality, bicarbonate decreases. This leads to high anion gap metabolic acidosis. Examples: diabetic or alcoholic ketoacidosis, drug intoxication. For example, acetaminophen or salicylates, and common one is sepsis with elevated lactate. Okay, the second one, in situations like diarrhea, bicarbonate is lost. To maintain ionic balance, the body increases chloride, so the anion gap does not rise. This produces hyperchloremic normal anion gap metabolic acidosis. Examples are diarrhea and renal tubular acidosis. To summarize, the anion gap reflects unmeasured anions. pH is influenced by bicarbonate and anion gap related acids. Metabolic acidosis occurs through increased anion gap and decreased bicarbonate with compensatory chloride rise. Understanding these two mechanisms makes the whole picture of acid-base balance much clearer. Now already you can reproduce anion gap and pH by yourself. Stay calm and act first. See you in the next video.